Hello all, welcome to PharmaNandan. In the previous video, we discussed the introduction to serotonin and the pharmacology of the serotonin with respect to its type of receptors pertaining to serotonin receptor 1A and 1B and 1D, right? In this video, we are going to cover the remaining receptors and its pharmacology. Coming to the receptor serotonin 2A, and this serotonin 2A receptor is also of GPCR type receptor, and this receptor comes under the subcategory GQ, and when it is stimulated there will be increase in IP3 and DAG. When antagonist is applied, so reverse will be happening. IP3 will be decreased and DAG will be decreased. What are the drugs, main drugs which are acting on this receptor? We know agonist means serotonin itself when act on in this one. And what are the other group of drugs which come under serotonin 2A receptors? Psychedelics. What are the antagonists which are acting on serotonin 2A receptor? Mostly atypical antipsychotics. Examples of atypical antipsychotics, we know risperidone, clozapine, and other serotonin 2A antagonists are pimavanserin, ritanserin, flibanserin. So coming to the distribution of this serotonin 2A type of receptor, where are these receptors mainly located? There are these, as it said, serotonin receptors has distribution in many areas. Main important area in which these 2A subtype of serotonin receptors are present are mainly in cerebral cortex. That means prefrontal cortex area is covered and parietal cortex area are also covered. The chief actions when these are stimulated is, that is serotonin binds to here or any psychedelic binds here, is psychosis. Main activity action is psychosis. Okay, and coming to what are psychedelics, to name psychedelics they should occur under three families. Okay, examples of the psychedelics are, first one, sorry, mescaline. This drug comes under the group phenethylamine, and the second drug is psilocybin. It comes under the family of tryptamine. And the third one is an ergoalkaloid, we know derived from ergo, LSD. Okay, these three to be grouped as psychedelics. In exams will be asked as which of the following are not psychedelics, which are not psychedelics. Keep in mind, MDMA is not psychedelic, and cannabis is not psychedelic, and ketamine is not included in psychedelic group. And the last one, this PCP, we call it as phencyclidine. All these are not included in the psychedelic group. Psychedelics are mainly three: mescaline, psilocybin, and LSD. Okay, and what are the antagonists acting on the serotonin 2A receptors? Number one, risperidone. It is an atypical antipsychotic. For clozapine, one more point we need to remember as per exams is, it is inverse agonist of serotonin subtype 2A receptor. And pimavanserin. Where is this pimavanserin used? It is used in Parkinson's disease when patient undergoes psychosis. The symptoms of psychosis in Parkinson's diseases, we see them as hallucinations and delusions in this patient. Here pimavanserin is used. If we use any other antipsychotic in Parkinson's disease patient, they will block the dopamine receptors also. So it causes more aggravation of the symptoms like this rigidity and all these things. Compared to all the other antipsychotics, pimavanserin is safest for hallucinations and delusions in the Parkinson disease. And one more, and the another drug, ritanserin. Coming to the ritanserin, the point we should remember it is an antagonist of serotonin 2A and 2C, both of the subtypes of receptors. This drug is mainly used for to increase the slow, what happened, this, we know slow wave sleep and fast wave sleep. Slow wave sleep we call them as NREM sleeps. Seen in, they increase the slow wave sleep duration. And the other drug is flibanserin. This flibanserin is used in premenopausal women. It acts as serotonin 2A antagonist plus 1A agonist. Where it is used in premenopausal women, there is a condition called hypoactive sexual desire disease. Let me make it capital. Flibanserin. Okay. And coming to the LSD, the latest thing is dose. What is the minimum dose of LSD? Even less than 20 microgram is enough for the person to make him to land in all the psychosis activities. LSD has agonist activity on serotonin receptors, dopamine receptors, noradrenaline receptors. Almost all the types of receptors are affected by this LSD. Coming to the next receptor, serotonin 2C receptor. Coming to the serotonin 2C receptor, serotonin 2C receptor. It is also of the same GPCR protein, and as I said now, these two receptors are always GQ based. GQ based, when stimulated, IP3 increases, DAG increases. Here when stimulated, when antagonist is bind, DAG will be decreased. So what are the main examples of the agonists and antagonists of serotonin 2C receptor? Main example for agonist is lorcaserin, which is used for weight loss of the patient, because when serotonin 2C receptor is stimulated, action is weight loss. So as you know, when this serotonin 2C receptor is antagonized, what is the expected action? Yes, weight gain is an expected thing. So the antipsychotic drugs, atypical antipsychotic drugs, when we studied in the earlier slide, they have a propensity to act as antagonist on serotonin 2C also. That is why we see atypical antipsychotics will cause weight gain in patients when used for prolonged therapy. And one more thing, one more drug which is sharing this antagonist property to serotonin 2C receptor is an antihistamine, very popular antihistamine, cyproheptadine, which is used in pediatric cases to increase appetite. It is basically antihistamine. This drug blocks histamine receptors plus serotonin 2C receptors also, causing weight gain in patient. That is why when children who are not eating well, who are having poor appetite, in pediatric age group, this cyproheptadine usage is seen. It is commonly used in as an OTC drug, over the counter drug. And main site of distribution of the serotonin 2C receptor is number one, many parts of the brain, And more important thing is choroid plexus. This choroid plexus, we know what is the choroid plexus. It forms the roof of fourth ventricle. It is very thin layer. And coming to the next receptor, serotonin subtype is 5-HT3. In the earlier session, we discussed earlier that serotonin type 3 receptor is the only one which is ion based channel. That is, when it is stimulated by serotonin or agonist, there will be rapid sodium influx. We call it as sudden depolarization causing the effect. What are the actions it will cause? What are the drugs which are affecting? Main group are antagonist group of drugs like palonosetron, ondansetron, and one more interesting drug is alo, not alu, alosetron. These three are important things. So where is it usually located? It is located in many sites. Predominantly two sites are important for us. One site number one is vomiting center in brain stem. So when stimulated, it results in vomiting. So we use antagonists. Another site which is very important is afferent neurons of splanchnic nerves and vagus nerve. When these afferent neurons are having this serotonin type 3 receptor, when they are acted with excessive serotonin or any agonist group of drug, it leads to a very dangerous condition called as Bezold Jarisch reflex. What happens here? There will be extreme vasodilation, extreme vasodilation causing extreme hypotension and extreme bradycardia. It results in the death of a patient if ignored and not treated in time, usually seen in the department of anesthesia during post-operative care. The treatment of this thing is number one choice is atropine, second drug which we use is epinephrine, and the third one is ondansetron. And pelonosetron it is an antagonist used for the vomiting, and alosetron has some special use in irritable bowel syndrome of females suffering with diarrhea type. It mainly improves diarrhea symptom. And ondansetron, wherever you see ondansetron has uses in highly emetogenic processes like cancer chemotherapy. But this ondansetron has few limitations, mm, few situations where ondansetron should not be used. Number one is in cancer chemotherapy vomitings, if they occur in delayed vomiting, ondansetron should not be used. Then the treatment of choice is eprofilast, which is a substance P antagonist, NK1 antagonist. Another condition in which ondansetron should not be used is Parkinson disease, when there will be on and off symptoms in Parkinson disease. When there is off symptom, clinically patient has more worsening symptoms. During off symptoms, there is a drug which we usually use is injection apomorphine as subcutaneous. This apomorphine is highly emetogenic. When apomorphine is used when there is vomiting, ondansetron should not be used because this apomorphine along with ondansetron, let me erase it. This apomorphine, when combined with ondansetron, it undergoes drug-drug interaction, leading to loss of consciousness of a patient. So, what is the treatment when there is vomiting during treatment with a apomorphine tablet? Trimethophenamide 300 mg tablet used thrice a day, at least 3 days before the use of apomorphine injection. These are two exceptions of ondansetron injection. Coming to the next type of receptor, serotonin subtype 4 receptor. It is GPCR type of receptor. It comes under the type of GS subtype. We know GS, when stimulated, there will be increase in cyclic AMP. When antagonist is placed, there will be decrease in cyclic AMP, or maybe cyclic AMP may be of same level also. This serotonin type 4 receptor, what are the chief drugs which are important? Here agonist groups are important, like tegaserod, cisapride, mosapride, prucalopride, and metoclopramide. This metoclopramide has two properties, two receptor activity. Number one, serotonin type 4 agonist and dopamine type 2 antagonist property. So where is this receptor located? The site of this receptor is mainly neurons which are present in superior colliculus and inferior colliculus and hippocampus. What happens when this receptor is stimulated? Actions. What happens when coming to the GIT? There will be two actions we can see. Action number one, it evokes secretion. And the second action in the GIT is, which is important pharmacologically, on which all this group of drugs are going to act, is it stimulates peristalsis of esophagus, not intestine. So this is the reason because of which these group of drugs are used in the GERD, so as to make the food flow faster, move faster from esophagus to the distal GIT. Is there anything which are recently developed in serotonin pharmacology? Yes, there is one drug called, let me go to previous slide. Yeah, well, I can't go to previous slide. Okay, there is one drug which is acting on 5-HT1F, that is serotonin 1F type of receptor, as a selective agonist. What is the action of serotonin 1F receptor? Precisely not known, but this agonist is proven to be useful in acute migraine. That's why it is approved by FDA. It is a recent drug called lasmiditan. This recent drug is approved by US FDA for migraine treatment, which acts as agonist of serotonin 1F, but the receptor property of serotonin 1F and its action is precisely not yet known fully. So thank you for your patience, and for any queries or suggestions, please email me to pharmanandan@zohomail.in. So total there are two videos of pharmacology of serotonin. So the earlier video, which is already posted, I will present in the cards above. You can see there. And this is the part 2, and this is the final part. Well, thank you very much.